My name's Claire Underwood. Today I'm talking about reducing and measuring cardiac stress in dressage horses. I do the equine cardiology and ultrasound at the University of Queensland Equine Hospital in Gatton. And we see a lot of horses with cardiac disease, but also horses that come in that don't have any signs of cardiac disease, really. But when you investigate further, they find out that some of what's wrong with them is actually caused by problems in their heart. So one of the reasons that horses don't show many signs until really late on is because they've got a really high capacity, and their cardiac capacity is really big, so they can manage with reduced function. And what we're looking at today is the things that affect the function of the heart and put more strain on it, so things like illness, exercise, electrolyte imbalances, and pre-existing cardiac disease, and how those can cause more strain on the heart, and how to identify when your horse has a heart problem, when it has even just quite subtle signs, what to do then, how to deal with it, and the importance of addressing any suspicion of a cardiac problem early, so that it can be managed properly. You can look at a lot of other things as well. So you can look at their upper airway, we look at their lung function, we look at their blood gas levels in their arteries, so we see if they're getting enough oxygen there. They looked at the lameness. They have an ECG on them, and they also have a stress echo, just like people do. So this here is a clip. Unfortunately, it's a standard bed. We do have all sorts of horses go on the treadmill, but this is just a little video of a standard bed going on the treadmill. So turn it down. So you can see he's got the artery catheter in there, which allows us to get blood from his arteries and measure the oxygen levels in that. He's got all his hobbles on. This is going on to the treadmill. The ECG is up there, and the scope is up there as well. And so we slowly increase this pace up to full speed on the treadmill. So here he's actually running at full speed. If you put the sound up a little, see, it's quite noisy. So that's sampling the blood for the blood gases. And he's also got a temperature probe in his jugular vein, so we can measure his body temperature and check that that's appropriate. That's his ECG there, so you can see his heart rate's about 220. And there's the scope, so that's looking at his airway. So we've got the scope down his nose, and we're looking at his airway at the same time. Because what will often happen in these horses is sometimes their airway will collapse, and then they'll get a heart abnormality at the same time, and you realize that one thing's happening because of the other. The airway collapses, they don't get enough oxygen, it stresses the heart muscle, and then it goes into an abnormal rhythm. And the other part of the stress test is to do an echo and look at how the heart responds to exercise. And one of the things that we do is we use some quite new technology called the speckle analysis, which looks at the strain between individual segments of the cardiac muscle and works out what strain and stresses there are on the heart muscle as it beats. And we can look for any abnormal areas of strain and stress, which are indicative of abnormal muscle behavior. So in terms of reducing cardiac stress in your horse, one of the most important things really is just investigating any sign of cardiac disease promptly, with an ECG and an echo if needed, because if that's allowed to continue, then it could worsen and deteriorate. And another thing that's really important not to do, like I mentioned earlier, is just don't exercise them at all when they're ill, or if this is, you can take their temperature if they've have a fever or there's a virus or something going through the barn. Be really careful about exercising them and make sure that they're well before you start doing that again. And monitoring their temperature is always a good way to do that. Another thing that will help to sort of reduce their stress and reduce their susceptibility to damage to the heart because of their being stressed or having high heart rates is to, if you travel them somewhere to a competition or something like that, just allow a little bit of time for the horse to get used to its environment So its heart rate goes down, so the cortisol levels go down, so there's less stress hormones, so that it can get back to normal before you start to ride it and put additional strain on the horse's heart. And then in terms of what you can do on a day-to-day basis to prevent cardiac damage, a lot of this is focused on sort of maintaining good electrolyte levels and a good balance of minerals and electrolytes in the blood. And the main thing, best way to do that is to feed a good quality balanced diet. But if you are supplementing with electrolytes, or you know that your horse has low electrolytes for some reason or other, it's important and really important to maintain constant supplementation. So if you go to a competition and you forget your supplement that has potassium in it, then it will affect the horse's heart because it will be used to having so much potassium and then it suddenly doesn't have it anymore. So it's always important to try and keep that constant. It doesn't necessarily, you don't have to give it, but if you do give it, make sure you keep it constant. And another thing to do is avoid supplements with any bicarbonate in them. So a lot of supplements, particularly white powders, will have a bit of bicarbonate in it, and this makes the blood a little bit alkaline, and it affects, again, the balance of electrolytes in the horse's heart, and can affect how the heart muscle works. So you'll often find it listed on the what's in the packet. You can also give the horse antioxidants to help, particularly at times of high stress. So vitamin C and vitamin E are the ones I commonly recommend to help prevent any oxidative damage in the heart. Okay. Well, thank you for listening. And are there any questions?